look to my Estonian colleagues, colleagues from Estonia. I'm aware that you have some problem with this to use these stains, but you know what? It's very strange because it's American Academy of Optometry. It's international guidelines, and in Scandinavia, or every optician can use it. For fluorescent green, definitely, and it's not drops, it's just piece of paper and staining. And by the way, from my practice, I would say such kind of staining I can perform even for small babies, sir, because sometimes I have also small babies like 2-3 years old, some or trauma or some inflammation in eye, and of course I put this piece of paper and put this staining in his eye, but it never ever any allergic reaction or something. For this reason, I don't know, you have to speak to your authorities and show them these international guidelines for optometrists. Yeah, and actually, I tell you, from my point of view, you can't put contact lenses without evaluation of a breakup test. Yeah, Schirmer is optional. Yeah, this rose Bengal is optional, but fluorescein is essential test for contact lens user. Yeah. So, and I believe there's place to get them. Okay, yeah. In Estonia, it's also available. Yeah, I can understand. Yeah. Phenol red thread test. You know, no, if you ask me again, this is, Krista, okay, about this phenol red thread test, no. I am using, I tell you, in Sweden, I'm using these just pieces of paper, exactly what Anastasia showed. Yeah, these small boxes, yeah, and we have this rose Bengal and Schirmer test in small boxes, yeah. But for this breakup test, I can use also drops. Yeah, I can choose or drops or also piece of paper. Yeah, but I tell you, my evaluation mostly, if you ask me where I am using this, all this staining or colors, yeah. I'm using, I tell you, number one for suspect Schirmer, this suspect Sjögren syndrome, yeah. And number two, of course, we are using this staining for patient with keratitis and keratoconjunctivitis, yeah. But in all these conditions, we are dealing actually with dry eye disease. Yeah, actually, also keratitis, it's still dry eye disease as well. Yeah, but if you ask me what's the difference between just dry eye and corneal ulcer, yeah, corneal ulcer, it is deeper effect, the deeper defect. Yeah, I hope that everybody of you know, and I hope that you are capable to distinguish between corneal erosion, yeah, and between corneal ulcer. Anastasia, can you distinguish between corneal erosion and corneal ulcer? Tell what's the difference between corneal erosion and corneal ulcer?
In epithelial defects, like in a range of the defect area, I suppose to. It will be my answer.
What is epithelial defect? What it is?
It will be the just erosion, but ulcer is when this condition are more deeper, like in the layers.
Penetrate when it is penetrate corneal stroma. Yeah. And again, about these corneal ulcers connected to contact lens, using of contact lenses, you know, the problem is that corneal erosion can heal without any consequences. I mean, somebody got, I don't know, some traumatic corneal erosion or recurrent corneal erosion. We put some slight antibiotic drops, yeah, and 3 days and it is over. Yeah, and there is again clear cornea. But if we're dealing with corneal ulcer, for example, due to contact lens, usually permanent opacity develops, yeah? And this permanent opacity can influence visual acuity. Yeah, it is a lucky person who has this corneal ulcer due to contact lenses somewhere near limbus or in middle periphery of the cornea, not the central 3-4 millimeters. Yeah, but if this corneal ulcer develop due to contact lenses in this central area, I would say 3-4 millimeters central, it will be permanent opacity forever. If opacity is small, okay, maybe it would be minimum influence on visual acuity, but if it will be a deeper ulcer or more defect, yeah, it could be some defect of vision, visual acuity. Yeah, and keep in mind that it can develop also slight irregular astigmatism. Yeah, if it is bigger ulcer. Yeah, I would say summary. If optometrists have done evaluation, I can see this that patient is in grade 3 or grade 4. Yeah, try not to offer to patient contact lenses, yeah, or just try to avoid putting contact lenses, yeah, because keep in mind that it can develop a corneal ulcer, yeah. Corneal ulcer, it could be some issues, yeah. And again, especially for person for whom is visual acuity is very, very important. Yeah, I would say that I had patients who could be very, very disturbing. Yeah, after they got some small corneal opacity, quite central in eye, yeah, on the cornea, and it influenced even a little bit visual acuity. Yeah, I speak about maybe mostly about pilots, military people, police, or something, or somebody else. Yeah. So just that I'll keep in mind number 3 and number 4 grade. Careful with contact lenses, yeah. And actually, if person has this grade 3 or grade 4 condition of dry eye disease, better to send to ophthalmologist, yeah. But grade 1, grade 2, you can carry on without any problem, yeah. But it will be very, very useful if I tell you this group of people who have some suspect just perform Schirmer test. Yeah, it will be more, how I say, you can motivate patients more if he has already Schirmer test below 5 millimeters. You can motivate patient, number 1, don't use contact lenses, and number 2, go to ophthalmologist. Yeah. Of course, you don't have to put this Sjögren syndrome immediately, but I tell you, just suspect. Yeah. Yeah, and I tell you, it would be just excellent if you can purchase Rose Bengal or Liza's in green.